Everyone, how are you? Welcome to another question and answer session. This is the physiology portion. A 22 years old lady receives intravenous morphine for acute abdominal pain, which is the pathway that it acts as a analgesic substances binding with mu receptor, delta receptor in the brainstem, binding of the delta receptor in the peripheral nervous system, binding of the beta opioid receptor within the CNS, binding with the alpha opioid receptor within the CNS, binding with the mu opioid receptor within the CNS. Now we have to find out one of the pathways. So for this condition, we have to know details about the morphine. So first of all, here see the four important type of morphine receptor. First of all, it is the delta receptor, which is located in the CNS, and it is responsible for analgesic action and antidepressant action. Then here this is the kappa, it mainly acting on the CNS, and it acts as a analgesic effect and also the dissociative effect. Then mu receptor, it has both central and peripheral receptor, and it causes analgesia, meiosis, and decrease gut mobility. Also the nociception receptor, it affects appetite and tolerance. But we have to know the analgesic property, which involves the abdominal pain, which will act on abdominal pain. We know the abdomen, it is a peripheral organ, and the lambda and kappa receptor, they act on CNS, but mu receptor, they act on this both central and peripheral receptor. So the morphine, it reduces pain in the abdomen by acting on the mu receptor. Here it is details about the morphine. Morphine is an opioid analgesic, and it is very strong analgesic, and it is a pro-type narcotic drug. But unwanted side effect may affect such as the nausea, constipation, respiratory depression, and addiction. So these are the side effect. That means the nausea, constipation, respiratory depression, and addiction. But it may be administered orally or intravenously, and it is reversed by naloxone. So this naloxone is another word which is very important. For reversal of the morphine, naloxone is used. When there is more morphine is introduced in this condition, for back from this action of the morphine, we can introduce naloxone. So what is the receptor? It is the mu receptor, because the mu receptor, it has both it presents both central nervous system and the peripheral nervous system. For this, the binding of mu receptor within the central nervous system, it affects the peripheral organ, and it reduces pain in case of the acute abdominal pain. Other option present, such as the alpha and beta, they are not significant or they are absent, but in case of mu receptor, they acts only the central nervous system.